Hi, welcome to Greenfield Community College to the Survey of Health Careers. I'm Lou Pugh and I'm here with Lisa Hoffmaster. She's an animal physical therapist and rehabilitation expert. So you have a really interesting background, I understand. Why don't you tell us a little bit about your education?
I started off in Bachelor of Arts from Elmira College, liberal arts education. And then I went back to school for majoring in theater. I did a lot of theater work and musical theaters. And I went to the University of Minnesota and got my Master of Arts in stage movement at Minnesota. Then I danced professionally and went to the University of Utah and Cal Arts, where I got 2 MFAs in dance. And I was a professional dancer for 35 years and had my own company in Canada. And then I burned out. And that's where I traveled around the world for 7 years and then came back to see my family and decided to do physical therapy because I'd been working with dancers and their injuries. Mm-hmm. So then I wanted to go to physical therapy school, and as I said, they told me that I was too old, but Russell Sage wanted some returning students. I think we were the first lot to go through and did, and so I majored in dance injuries for my physical therapy, had my own business, and then the animals called. And so then I went to Adirondack Community College and Canton for my licensed vet tech degree. So I'm a licensed vet tech, as well as a physical therapist.
So how did that transition happen between doing physical therapy with people to animals?
Well, I've always loved animals. I have a menagerie at home. And I knew that my career with humans, as much as I loved it, was not quite satisfying for me. And I kept treating my patients animals when they brought them in. And I said, oh, I would love to do this. I love working with the animals. So then there was nothing available. There still isn't anything really available for animal rehabilitation per se. So you have to combine things. So that's what I did. I had the physical therapy, and so I felt I needed to go. I did not want to be a vet, although now I almost am, but that's why I went to licensed vet tech school, so that I could become almost equal. I have more manual work because of my physical therapy, which has come in handy. And then licensed vet tech, because of my state licensing, I have to have the licensed vet tech. I cannot practice on any animal, not even a flea, with my PT degree in New York State, or they will take it away and I will lose it forever. So you need to check that whenever you're switching, just to make sure what the laws are in your state. So there you go. So I'm a licensed vet tech, so I get referrals from veterinarians, and now I'm attending osteopathic school for equine and small animal.
Can I ask you 2 questions about that? One is, was it difficult to be accepted by the local veterinary community? And if so, how did you get referrals?
I got referrals essentially from my own vet, and I worked in a veterinary clinic and the emergency clinic as well. And so they would let me work on the animals. I would say, oh, let me do this. Let me do range of motion to this animal recovering from surgery. They said, okay, that's fine, because they knew me and I was a licensed vet tech. For animal rehabilitation to be accepted into the veterinary field, I've been doing it for 8 years now. When I started, there was basically nothing, so it was a new field. So like anything, like alternative medicine in human medicine, which means homeopathic, acupuncture, Chinese medicine, a little leery. And now it's becoming more of a mainstay because the clients themselves ask, I want my dog or my horse to have some some work done. It needs it because it's been jumping so much or it has an injury. So that's really changed and it's coming about. I predict in another 5 years it's going to be a really, really mainstay in every veterinary clinic. And if they don't have it, they're foolish not to have somebody on board who can do it. And a lot of vets are doing it now. They're going and taking courses. I've taken the one at Northeast Seminars at the University of Tennessee. That's one, and CRI, Canine Rehabilitation Institute, are the two major ones, but there are a lot of minor ones, and some are more accepted by vets or by the medical field than others because of their program.
Mm-hmm. And are you paid privately by clients, or are you paid by the veterinary service or the veterinary clinic?
Both.
Both.
If I work in a veterinary clinic, I'm an independent now, but when I worked in a veterinary clinic, they paid me a salary, and then if somebody wanted me to come out to their house, they would pay me extra and see the animals in their home, which I think is much, much better, actually, to be honest with you. Unless they're recuperating, you know, an ICU or something at the veterinary clinic.
Now, you've talked about really loving working with animals. What do you see as the differences between working with people and animals, other than, you know, the obvious one?
Well, there's something about the animals, their spirits, their, of course they cannot tell you where they're painful. So you really have to be in tune to the signs. To be honest with you, they are much more grateful than humans as regards what type of work you do. There are people who are grateful for what you do and accomplish for them. But overall, the animals, I haven't met one or treated one that wasn't appreciative. And you know it, that they know you're trying to help them. And I think that's the clue. I work in a rehab center right now, per diem, human. And it is a challenge because sometimes those humans don't want to get up and walk. And you have to be that inspiration. I feel that the animals come halfway. I'm there, they're there, and we're there to help each other get well. And I'm an advocate for those animals. Each and every one that I touch, that I come in contact with, because they have no voice like the humans do.
Now, a moment ago you were talking about studying osteopathy. Do you want to explain what that is and how are you using that in your practice?
So, how many know what osteopathy is?
It's the study of bones.
Right, osteo, yes. But it goes much more. It's more of a total body, and it's in human medicine too. It's a total body treatment, way of looking at the body. And I'm saying through the movement of your cranium, your bones in your skull, how your viscera, meaning all your internal organs work, how your bones are aligning, coming together. It entails all nutrition, social. It's more of a complete holistic way of looking at the human and the animals. Not just bits and parts, like in human medicine, maybe in PT. Somebody comes in with a shoulder now, we treat the shoulder. In osteopathic work, we look at the shoulder and say, well, maybe something's being affected in the neck and then down in the digestive tract, and that needs to be treated as well in order for that shoulder to get better. Okay? So it's more of a complete. It entails a much more complete way of looking at a body and treating a body. On and on. There you go. So whatever applies to the animals, what I'm studying with a fellow from Belgium, Yannick Flugen, and he has treated the top equine horses in the World Cup, any of the Olympics. And whatever I'm learning there, I can apply to the small animals and to myself and my human component. It's all the same.
And you're also working with horses now.
Yes.
Yes, well that's pretty exciting.
Yes, it is. Yes,
So
it is.
Are you doing a lot of traveling with your work?
Yes. I'm going down to, sometimes I'll go down to Florida and work with people down there, and then obviously in New York State, upstate New York, Cambridge area, and then I've been going to Texas a lot and treating horses.
And would this be for, say, a polo team or for a farm, or why would you be doing the traveling?
I'm at the Whole Horse Clinic, which is in San Marcos, and people bring their horses from all over to be treated there. So it's pretty exciting to see them being treated with Chinese medicine, acupuncture, Reiki, massage, the whole gamut, because they've been caught in a fence. And they're, shall I relate an incident? Oh, this
yeah.
fellow that I work with. Four horses came in 1 week that had their necks totally luxated. Do you know what that means? Here's the skull. Here's the head sitting on the spine. They'd gotten into something where this happened. So, number one, think about where the spinal cord is going, like it has to, and the neuroscience, incredibly, each of these horses did not have great neuroscience, meaning, you know, total lameness in front or something. But how do you get that head back onto the atlas without injuring the spinal cord and causing immediate death? That's the challenge. And that's what osteopathic does. It's some manipulations of the bones to get them back in alignment. And so what this fellow did, we had to traction the necks in a certain position and then put it back in without injuring the spinal cord. And every horse made it. Total recovery. So that's the power of this. So there you go.
Yeah.
It was pretty amazing because everybody else had written the horses off. The regular vets had written and said, put them down. There's nothing you can do to help them. And so, pretty amazing to see. So.
Now, are you creating your own program? Because are there other people out there doing what you're doing, or are you pulling together the education that you need?
There are other people out there who are doing what I'm doing. A lot of vets in their own practices are starting rehab. Is that what you're talking about?
Well, as a physical therapist, it sounds like you're really pulling from a lot of disciplines.
You bet. And I think that's the clue to this career is you just can't go and take a course and hope to get the manual work in that. Do you know? It's constant educating, taking a massage course, acupuncture, homeopathic, naturopathic, and drawing it all together. I've been very fortunate to work with some pretty fabulous people and learning from them to bring it in. So I'm building a toolbox, and if I had to say anything to people who are going into a medical field, you have to create your own toolbox, because you're going to get a patient in nursing, say, recovering in ICU. Man, I can't get the IV in. So what do I do? Oh, maybe something's wrong with the arm and it needs to be readjusted so that you can get it in and get the vascularization going. So there's a lot of ways to look at something. And if you have tools to do it, it's phenomenal. And you can do it as a nurse, as a massage therapist, you have that knowledge. And so take everything. I've taken every course I can. I've brought a book. That's half of it. I just go, I've got to know about the feet. I've got to know about this. I've got to, So I create it, and when are you going to use this? And then lo and behold, one day you go, oh man, I know. Oh yeah, the vestibular. Okay, I get it. Okay, and to help that patient, that's your job. I want to help that patient get better, and how am I going to do that? I need to know as much as I can. And right now, I'm just in the learning stage. There's so much more. That's the glory of it all. It never stops. And you may see a doctor do a maneuver and you go, holy, where'd you learn that? Oh, I don't know. It just told me to do that. And that's what I did in PT too. Why are you doing that? Where's the scientific data? I don't have it, but I think this will work. And then it does. And the patient gets better. Isn't that the important thing? So there you go.
Now, in addition to doing your own continuing ed for your
Yes.
own knowledge, what do you have to do to maintain your certification as a vet tech and as a PT?
Okay. Physical therapy in each state is different. Right now, New York State has just passed a law last year that I have to take 30 hours of continuing ed within 3 years. That's hard to do when you've taken everything that I think, unless they come up with some new things. And anything in animal rehab you see in that state does not count because they don't recognize that. So that's one thing. So each state is different. But if I go into Vermont and I have a license in Vermont and Massachusetts, Vermont I know doesn't have any CEs, no continuing ed. But I'm not sure about Massachusetts. I don't know what they've done yet. So for my licensed vet tech, I don't need any continuing ed in New York State. Now some places out west you do. Vermont, no. Massachusetts, I know that they're starting a licensed vet tech, that you need to be licensed in this state to practice. They're getting that going. That's the last I heard. I read through my vet tech. So before, you didn't have to be a licensed vet tech to work on an animal. So those are the guidelines right now. But each state is different, and that's the catch-all. I think I know somebody in New York State who moved from someplace south, came into New York State, started an animal rehab over in the west, got her license taken away because she wasn't legal. You see, and she probably just didn't check into it, thinking it's the same from state to state, and it's not. So you've got to call your educational department and say, what are the guidelines here? And
as a licensed vet tech, do you carry malpractice insurance as nurses do, as doctors do, as PT? Okay.
Have to.
Yep.
In case that, oh yes, in case that horse falls down or the animal, yes. And so they have special, I can get it through my PT and my licensed vet tech animal rehab. They have a special licensing, insurance for it that they've created because they know it's difficult to get in some states, so they've created that.
So should we open this up to the students?
Maybe.
Do we have any questions from the audience? Yes.
I just would like to encourage everybody that even if you're not considering this as an occupation for yourself, that you actually think about asking some questions, because I think it'll help other folks in the room that might not have thought of that question. And I do have a question.
Sure.
Could you tell us what is the biggest and the smallest animal that you've worked with?
The biggest is a Belgian horse.
Okay.
And the smallest is a parakeet.
Can you say a little bit about what you did with the parakeet?
He had a wing injury in the veterinary clinic, and so we had to bandage it and then keep the range of motion going. So we did. And that's how just very small. It's just tiny, tiny. And then ferret. And then the next would be a cat. Oh, and we did a deer. We did a goose. So You never know, and I don't know why I've gotten the reputation for working on alpacas and llamas, but there you go. It's a big trade in my area, so some of them have gotten, when they're born, their necks have gotten crunched. So you need to work on them, and they've made it through. So there you go.
I have a follow-up. You know, those are a lot of skeletons and a lot of bodies to be knowledgeable about. Are you always going back to either electronic resources or to your books to sort of check out what you're doing?
I tend to be a book person.
Mm-hmm.
I'm not, because I didn't grow up in the computer era. So I have my library is quite extensive, or I'll, call somebody and say, what do you suggest? You got,
Mm-hmm.
But basically I'll go back to my books all the time and refer back, because I'll forget how a suture is in the skull or something, exactly where it might go, or a small bone in a foot or something. So I will absolutely have to go back and refer. Or somebody will name a disease and I go, oh man, I should know this. So I have to go back,
Yeah.
look it up and go, oh yeah, okay.
Questions? Yes.
Yeah.
What species of animal has been your favorite to work with?
They are also, different. I started off with small animal, dog and cat, and I loved them. And then I started working on horses out of my own fear, because a horse had ridden away with me, and I didn't ever want to touch a horse in my life. And it just so happened that this fellow that I wanted to study with worked with horses, and I said I better do something. So I started working with the horses, and I love them. I have two of my own now, and there's something very special about them. And let me just, you go, oh, well, dogs can be vicious and they're angry, and the horses can be, they're usually trying to tell you that they're not comfortable, they're in pain. And that's the same way with humans, too. If they don't, oh, I'm fine. And you watch them, and that's when their behavior changes, is that they're in pain, they're trying to tell you something, I'm not comfortable. So something's wrong. So keep that in mind when you look at somebody. They're not going to tell you. Just as an aside, yes?
I was just wondering about exotic animals, the people, like large animals like elephants and things.
Oh, yes. I mean, that's a whole other field. Now, I'd love to do that for a year, is work in a zoo. And I have gone through the zoo down in Orlando, and they did a backstage type thing and what they do, and I think it's fascinating. Yes, lizards, snakes, every kind of
And
being.
do they do the physical therapy with those animals ever?
Oh yes, and wildlife rehabilitation is a whole other area, okay? And you have to be licensed in New York State. You have to be licensed in order to treat like hawks, bald eagles, okay, squirrels, raccoons, because if you have them, they're illegal to keep them as pets, okay? But it's a fascinating field. I loved going through and watching the vets. They had to, repair a leg and it's fabulous. It's fabulous. And some of the things you do in human physical therapy, they're doing on an elephant. You go, holy, okay, okay. But that's another area. And you have to be a vet tech, okay, to do that in a zoo. That was I would love to at least, be in there with the lions and the tigers. Yeah. Open your mouth. So there you go. Does that answer the question? Okay.
Other questions? I have a follow-up then, which is, what do you think are some of the biggest challenges for students who are considering your field? Well, I mean, your field is pretty broad at this point, but physical therapy, vet tech work.
I think the things that stick out, and this is nursing too, because I know it's as rigorous. You get into the program, and I won't lie to you, it's tough. You have no other life except that, because you put down one book and you pick up another, and you have an exam, and it's sciences, and it's memorizing till one day. I mean, I think I had 3 meltdowns in PT school, throwing my books across the room saying, I can't do this, but keeping in mind what you want to do. I said I wanted to treat dancers and their injuries. I've got to get through this program. I've got to do this. Also, with licensed vet tech, same thing. The amount of info in 2 years was mind-boggling to me. And thank God I'd gone through PT school. To get the discipline to do it, do not give up. Because there are going to be times where you're going to go, why am I doing this? Then search your soul and go, why am I doing it? Because I want to help people. I want to be in the ER. I want to be in the surgery. I want to work with kids. That's what you have to keep. Go out, take a deep breath, and go back in, because it is rigorous. Nursing, OT, PT, PTA, OTA. It is not easy. It's very demanding. It isn't, you know, I don't know. It's not like my theater classes, okay? Yeah.
So like with any big goal in life, when there's a lot of preparation toward that goal, and sometimes, you know, what I hear you talking about is the sometimes getting lost in all of the preparation. And so I'm wondering, how did you keep yourself in those moments when the work almost made you lose sight of why you were doing it? And I think it's a question that we all ask ourselves sometimes, especially perhaps students who have goals that have not, you know, they haven't achieved them yet, and they're out there in the distance. And in the meantime, they have to do what sometimes appears mundane and ordinary and boring, and hard. So how did you keep yourself on task?
I kept reminding myself why I wanted to do it. And also I had Dr. Loomis at Canton I owe a great deal to, because I went in and I said, I'm quitting. I'm out of here. I'm back home. And she said, oh, no, you're not. Because you've got the potential and you need to work on it. And don't be afraid. And do it. And don't be afraid. Maybe you're not going to be the A+. I wasn't the A+ student. I was right in the middle or down there in the C department, but I passed. And that's the important thing. Give me the ticket, and then you have all those options to go into a hospital. Maybe you don't like OB/GYN or massaging this and that. Maybe you want to get into lymphedema control, or you find that niche, okay? But that field gives you the opportunity to, and you've got to keep that in mind. That's what and once you make it through, nobody can take it away from you. Got it? That's the thing. And if you go out and cry, I cried, I screamed, and then Dr. Loomis, I went in and she said, no, what are you having a problem with? We'll help you with it. They'll find help for you. I'm terrible at math. Oh, bleh. And guess what? I had to do it. I made it through because there were people there who helped me. And always look for help. Don't say, I'm just not good enough. Yes, you are. You have something to offer that field. You may not know it, what area it is. It'll show you. You'll get into one. Oh, could you do a weekend shift in the OR or something? Oh gosh, yes, I hate blood. Okay, I'll go in, and there you are, and you're fascinated by what the doctor's doing and helping him, and then you'll become a surgical nurse or something. Do you know see what I'm saying? You don't ever know, and take those opportunities. It'll lead you to maybe not be a nurse on the floor, but maybe a nurse someplace else. Maybe a nurse over in Africa, over on an island. You're it, taking care of somebody on an island. They don't have anything else. So that's what I'm saying to you. It isn't so. Just get through the coursework. And some of it you'll love, some of it you'll just, yeah, oh my gosh, what's this got to do with it? And there were times, what has this got to do with what I eventually want to do? Well, you've got to do it to get the ticket and get licensed. That's all. And once you get it, then you have the freedom to go anywhere.